Hello everyone, I'm Dr. Do-Young from Hill House Dermatology in Seoul, Korea. It is my pleasure to introduce Opus, the unipolar RF system from Alma Lasers. Today, I would like to explain how it works and share the protocols that I use in my daily practice. Opus is Alma Lasers' unipolar RF platform powered by the exclusive 40.68 MHz unipolar RF technology. With 5 uniquely designed applicators, it allows us to precisely target various layers of the skin, from superficial to deep, and effectively treat a wide range of skin concerns. And this flexibility allows us to customize each treatment based on the patient needs, whether it's wrinkles, skin laxity, irregular skin tone, texture, or even scars. And that is what makes Opus such a versatile and valuable system that I rely on every day. Opus applicators are mainly divided into 2 categories. The first, the RF pixel applicator, which is used for ablative treatments through a microplasma effect. And second, the unipolar RF applicators, which are non-ablative and used with a gliding motion. And this group includes unilarge, uniface, unibody, and coaxipolar applicators. The RF pixel applicator can be used in either rolling or stationary mode. It creates microchannels on the skin surface using a microplasma effect, which triggers the natural regeneration process of the skin. And these microchannels can also serve as a pathways for drug delivery. And this makes the RF pixel highly effective for improving scars, large pores, pigmentation, and overall skin tone and texture. Next is the unipolar RF applicator series. Unilarge is Alma Lasers' signature unipolar RF applicator, a classic design with proven technology that has been widely used for over 20 years. Uniface combines unipolar RF with the spin activator, a spinning wheel with massage balls, and it promotes lymphatic drainage and helps prime the dermal environment, making it ideal for detox treatments. And finally, Unibody is the body-specific version of Uniface designed to reduce cellulite and improve body contours. The final applicator is coaxipolar, which uses Alma Lasers' unique bipolar RF technology to precisely target the more superficial layers of the skin. It is especially effective for a thin and delicate areas such as the forehead, the eye area, and the neck. One of its key benefits is the immediate tightening effect that patients often notice right after the treatment. Now let's take a look at more specifically how each applicator works along with its specific treatment protocols. The first applicator I'd like to introduce is the RF pixel. It is based on microplasma technology, which generates plasma sparks by reacting with the oxygen and nitrogen in the air. These sparks create microchannels on the skin surface. Another unique feature of Alma Lasers' RF technology is phase shift. This feature allows us to control the focal depth of energy, which directly influences the treatment outcome, whether it's thermal stimulation or ablation. And with this control, we can either induce strong ablation in the superficial layer or minimize ablation while delivering thermal energy to the deeper layer. And this means that even with the same applicator and tip configuration, we can achieve completely different treatment outcomes simply by adjusting the energy level and focal depth. The RF pixel applicator offers a variety of tip options, allowing for greater flexibility in treatment. And there are 3 types of roller tips: 3 rows, 6 rows, and 15 rows. The 3-row tip is mainly used for traumatic scars and keloid scars. The 6-row tip is ideal for acne scars, enlarged pores, uneven skin texture, pigmentation, stretch marks, and fine lines, making it a great choice for overall skin rejuvenation. And the 15-row tip is primarily used for skin peeling and superficial fine lines. As previously mentioned, there are 2 treatment modes available: thermal and ablative, depending on the energy level and treatment goals. In thermal mode, which is level 1 to 2, the tip maintains full contact with the skin and delivers heat without generating sparks. It causes minimal discomfort and allows for frequent, routine treatments. This mode is especially popular for Asian skins as it minimizes downtime and reduces the risk of post-inflammatory hyperpigmentation. In contrast, the ablative mode, which is like level 3 to 4, involves holding the tip slightly above the skin to create the plasma sparks and microchannels, promoting stronger skin regeneration. It is ideal for treating scars and deep wrinkles, but it comes with more downtime and a higher risk of pigmentation, so careful patient selection is very important. And because it's fast recovery and low risk of post-inflammatory hyperpigmentation, thermal mode is often selected for routine treatment and ongoing maintenance. Our Pixel applicator also comes with the stationary tips designed for targeted treatment on localized areas. Let's start with the spark tip. It is applied at 45-degree angle with light contact, and this tip is used for gentle resurfacing, helping to improve skin texture and tone with minimal irritation. Because it's so mild, it is often preferred for light, casual treatment, especially clinics across Korea. Next is the ice pick tip, which is applied using a stamping motion, typically 2 to 3 passes on the same spot. It is ideal for precise, focused treatment such as acne scars, inflammatory lesions, or other small target areas. Lastly, the colibri tip is used with minimal contact or by slightly hovering above the skin. It is designed for delicate areas like eyelid wrinkles, skin tags, and other small localized lesions. And this tip is used less frequently in Asian patients due to the skin tendency toward pigmentation. Depending on the treatment area and purpose, both roller and stationary tips can be used in combination. Pain levels and downtime vary depending on the intensity of the energy delivered. Mild treatment results in minimal downtime and can be performed more frequently. In contrast, higher intensity settings provide more dramatic results but require longer recovery time. Now, I will demonstrate the procedure using our Pixel roller tip and explain the settings and techniques I use, including energy levels, number of passes, and applicator handling. This is the RF Pixel roller tip, and I usually work with 6-row tip. The energy level is adjustable, and depending on which of the 4 phase shift levels you choose, from thermal to ablative, you can control how gentle or aggressive the treatment will be. Personally, I prefer thermal mode, level 1, for a gentler approach. It is effective enough to achieve visible result while keeping the risk of side effects, such as PIH, very low. I typically use settings between 10 to 25 watts depending on the patient's skin condition. And one important tip is to keep the tip in full contact with the skin. Don't let it lose contact with the surface. You can activate the energy either with the trigger button on the handpiece or with the foot pedal. For beginners, I recommend moving in one direction only, and I usually prefer pulling strokes. And once you are more comfortable, you can switch to bi-directional strokes. I usually do 3 to 4 passes, and the endpoint I look for is mild erythema. Sometimes you might hear a slight buzzing sound that usually means the tip has been briefly lost contact with the skin. This can lead to microcrusting, so always try to maintain firm and even contact throughout the treatment. After RF pixel roller treatment, the skin is filled with microchannels, making it a great opportunity to apply exosomes or other skin boosters for enhanced results. This is the ice pick tip. Unlike the roller tip we saw earlier, the ice pick tip is used with stamping technique rather than gliding. And I typically use it at 75 watts, level 1, and perform 2 passes over the areas with inflammatory acne, post-inflammatory erythema, or depressed acne scars. As you can see, the treatment is very straightforward. It's also effective for the areas with enlarged pores, and if needed, I sometimes lower the energy to 10 to 15 watts and add 1 pass in level 4 ablative mode for additional resurfacing. In thermal mode, the goal is to modulate cytokines like TGF-beta, which helps promote physiologic skin regeneration. That's why I avoid using overly aggressive settings, just enough to stimulate the skin without causing excessive damage. Now let's move on to the unipolar applicator group, which is used with a gliding motion. All of these applicators deliver Alma Laser's signature 40.68 MHz unipolar RF energy, which penetrates deep into the skin to generate heat. And they are highly effective for skin tightening and lifting, improving microcirculation, and priming dermal environment for enhanced rejuvenation. First, we have Unilarge, Alma's signature unipolar RF applicator. It delivers pure, focused unipolar RF energy and is ideal for patients with sensitive skin or those seeking a gentle, non-irritating treatment. Next is Uniface, which is one of my favorite, and it combines unipolar RF with the spin activator, a spinning wheel with a massage balls. And this applicator promotes lymphatic drainage and helps to prime the dermal environment, making it especially effective for detox-focused treatment or as a warm-up step before more extensive procedures. And finally, we have Unibody, the body-specific version of Uniface, and it works in the same way, combining unipolar RF with the spin activator, but features a larger contact surface, making it ideal for treating broader areas. It is commonly used for cellulite reduction and body contouring and serves as a valuable tool for non-invasive body shaping. All 3 applicators are used with a thin layer of coupling oil and applied using the in-motion technique, providing a comfortable and pain-free experience. The power, total energy, and penetration depth are adjusted based on the treatment area, skin thickness, and clinical goals. What makes this system especially interesting is its ability to control thermal penetration depth. With Alma Laser's phase shift technology, we can fine-tune how deep the energy reaches from superficial to deep dermal layers. Depth levels range from level 1 to level 4, allowing for fully customized treatment depending on the clinical objective and skin characteristics. Now I will demonstrate the procedure using Uniface and explain the settings and techniques I use, including the energy levels, number of passes, and applicator handling. Once you press the ready button, the spin activator starts to rotate. Then when you press either the trigger button on the handpiece or the foot pedal, the heat delivery begins. The procedure is very straightforward. After applying a thin layer of oil, simply glide the applicator evenly across the entire face. And for added benefits, you can follow the direction of lymphatic drainage to help clear excessive fluid or metabolic waste. Patients usually find treatment very relaxing and pain-free, and many describe it as a warm, soothing massage, something new and surprisingly pleasant. I typically use 100 watts at level 3, delivering around 15 kilojoules per side of the face. I call this treatment Opus Detox, and it's a skin conditioning protocol designed to restore and condition the skin through 4 essential steps. First, unipolar RF energy gently relaxes deep dermal tissues to reduce stiffness. And second, the rotational stimulation reorganizes collagen and elastin within the extracellular matrix. And third, improved lymphatic flow clears excessive fluid and metabolic waste. And fourth, activated fibroblasts promote collagen synthesis for improved firmness. Opus Detox isn't just a standalone treatment. It also works remarkably well as a preconditioning step, preparing the skin for other tightening or lifting procedures and enhancing their overall results. Coaxipolar is Alma Laser's bipolar RF applicator. It features a unique coaxipolar electrode design where unipolar RF energy is delivered in a bipolar pattern within the tip. If you look closely, you will see a central electrode surrounded by an outer electrode, and there is a clear difference compared with the classic unilarge tip. And this design enables precise and controlled heating of the more superficial skin layers with selectable penetration depth of 1, 3, 5, and 7 millimeters. And because of this, Coaxipolar is ideal for thin and delicate areas and can be safely used across the entire face, including sensitive regions like forehead, around the eyes, and the neck. Patients often notice immediate tightening, smoother skin texture, and visible improvement in fine lines right after the treatment. Now, I will demonstrate the procedure using Coaxipolar and explain the settings and techniques I use, including energy levels, number of passes, and applicator handling. Like the other applicators, Coaxipolar can be activated using either the trigger button on the handpiece or the foot pedal. Personally, I prefer using the foot pedal for better control. And after applying a thin layer of coupling oil, the treatment is performed with a gentle gliding motion. Because the tip surface is slightly larger than that of unilarge, it allows for smoother and more efficient coverage. I typically use an energy setting between 35 to 40 watts, delivering around 5 kilojoules per side of the face. And for penetration depth, I usually set it to level 1, the deepest setting, and the procedure itself is very straightforward and easy to perform. So today we have covered the key features and clinical techniques for all 5 Opus applicators. And if you have any further questions or would like to learn more tips, feel free to reach out to me on Instagram. I'll be happy to help you get the best possible result for your patients. Thank you and stay tuned.